Dr. Fuzela is live in the studio with us this morning. Yeah. Doc, welcome. Good morning. That's our intro.
Thank you very much.
Doc, people like Lenny will eat and 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 eat. Gain weight, and they start injecting themselves with all sorts of things. Now I heard it's called Ozempic or something.
Ozempic.
Yeah. But so we're going to be discussing this weight loss syndrome that has now eaten into a lot of people. If you understand, eating into a lot of people after they finish eating and then want to melt down this fat. It's a great conversation to have, but we've seen a lot of people now injecting themselves to achieve this. What is this Ozempic? And there's a sudden rise of, in fact, this whole drug abuse is a conversation to be had. But what is Ozempic?
Okay, so I'm very happy that we are talking about this today. But first of all, I want to let us take note of the fact that Ozempic is just a brand name of a medication. No, like how? Okay, yes, or maybe paracetamol, but you can get different brands.
Panadol,
so also
Ranadol,
like
Smaladol.
yes, so maybe toothpaste, but over here always you say Pepsodent, so something like that. So yes, so when you say Ozempic, it's a brand name of a medication, and the medication itself is called semaglutide.
It's called what?
Semaglutide. Yes.
Semi, like semi. Semaglutide. Okay.
Yeah, so there are different brands of semaglutide actually. So it just happens that Ozempic is like the popular one that a lot of
it's the
people.
Man United. Of
yes.
It, everybody knows.
Oh no.
Wait, dog, calm down. No, dog, this one no dear, dog.
Dog takes strict like this one. I beg you, hold on. Let dog continue.
But this one no dear,
Dog has given you a Manchester United listing there. I beg you.
How can you say that?
But we are the most popular.
Power to you, dog.
We are the great.
Popular
keep it
doesn't
coming,
mean
keep
you
it
are
coming.
the best.
So what do Manchester semaglutide do?
Yes, so
It's a Manchester glutide.
so to understand, let me just
You will not talk
explain
again,
briefly so that everything must start from the basics. To understand, we have to understand that first of all, this medication is originally a drug for treating diabetes, and what it does is that, so basically the mechanism of action is that it's what we call a GLP-1 receptor agonist. Okay.
Hey, babe.
The GLP-1 is a hormone.
Dog, that sounds like a Kanama place again.
Yeah, but I have to explain
G1.
it.
So as
GLP-1
GLP-1. That's a Ghana Premier League.
receptor agonist. Yeah, I've not even mentioned the full name.
What's the full name, please?
So glucagon-like peptide 1 receptor.
You just take it.
Yeah. So that's why. So let's just restrict ourselves to GLP-1 receptor agonist.
Okay.
So basically, there are a number of factors that lead to people having diabetes. So all the medications that we use in treating diabetes, they usually target a particular aspect of it.
Okay.
And for the purpose of this discussion, one of the aspects is that whenever you start eating, every ordinary person, your brain is stimulated, then it lets your intestines release this hormone. And it's this hormone that gives you the feeling of satiety, that, oh, I'm full, let me stop eating.
I need to stop that hormone from making
So that's what, then it reduces your appetite.
Okay.
So what I mentioned was that the semaglutide is so they are agonists to this hormone. When we say agonist, it just means that it mimics or acts like it. So when you are giving someone semaglutide, basically what you are doing is that you are mimicking or giving the person artificial GLP. Yes.
Okay.
So what the medicine would do is, so you already understand. So what it does is that it reduces their appetite, because we believe that, we all know that the more you eat, the more weight you are going to gain. So they take it, one is going to reduce their appetite. Then when they even start eating, they don't eat much, but they'll feel full, like they'll become satisfied. So it also helps in reducing your intake. Then it also reduces the emptying of your stomach. So it allows the food to stay in there a bit, let me say, longer than it should be. So the slow transit time. So also in a way reducing your hunger. So basically that is how the medication works.
Okay, Doc, we know some medications were designed for certain things, like we had when we were young, we heard of The one that they use to stimulate sexual whatever in pigs.
Viagra.
No Viagra. There's
Spanish
another
fly.
one. Spanish fly. We have something called Spanish fly. I don't know the scientific name for it, but this is the student name. It's Spanish fly. But yet it was used for other things. Now we've heard about tramadol, which is and for excessive pain, relief, but it's now turned into a drug for something else.
Yeah.
This semi-glutide and the Ghana Premier League one that you mentioned. Is it was it for any intended purpose, or this was the purpose?
So the purpose of the drug is to treat diabetes. That's why I talked about
to reduce your intake of sugar.
So it's a treatment for people who have diabetes where their blood sugar goes up. So in a way, it controls their sugar. It does other things like releasing more insulin and all that. So the main thing is that it's a medication for diabetes.
Oh,
okay. But looking at how it works, we could say that its side effect is that aside treating the diabetes, it will help you lose weight.
So is it that because in the treatment of diabetes, how does this work? Is it that it increases? Okay, you said it increases insulin.
Yes.
Okay.
It's one of the it does a lot of things, but I talked about the most basic things that it does. Yes. So eventually it's going to help control the person's blood sugar.
So for
because
somebody,
because remember we talked about the fact that it's going to make you satisfied, which means you don't eat much. If you don't eat much, you are not putting in so much calories or sugar into your body, and that's a way of controlling it. If you look at the diagram that we projected, there were about 8 things, and I said that there are different. There are so many mechanisms that lead to diabetes, but this is one of them. So as I said, the medication targets the medication. I don't think we have enough time. The medication targets that aspect, which on top. So you realize that
GLP-1,
yes, the first one. So I said that naturally when you eat, these hormones are released. That's what we call the incretins. And so that's what will help you.
that word, incretins.
Yes, it's a very nice word.
Yeah, incretins.
So that's what gives you the sensation of being satisfied, so that you will stop eating.
Wait, that's hormone.
Yes.
Is it released maybe when
you
eat?
No,
I know when you eat, but not to overexpand your stomach or put extreme pressure on your intestines of any sort. Is that when it is released? Like, does it trigger when certain muscles are contracted? I don't know. I don't know if you understand what I'm saying.
I get what you are saying.
Yeah.
So in simple terms, what happens is when you eat, when you take in food, as we take in food, when you take in food, the intestines are stimulated to this thing is released from your intestine.
Okay.
And that gives you that feeling of, okay, I'm satisfied, so let me not eat. It reduces your appetite.
So are we saying that?
Don't eat. Then aside that, as I said, it reduces transit time. Within. That's one of the side effects.
Since you've explained that, so somebody who has an maybe an issue of this hormone not being released, what then happens to the person when the person?
I like
eating?
Where you are going.
Yes.
So actually, studies have shown that there are some people who have an impairment of the secretion of this hormone, and that is, and from what we've explained, that means that if you have a problem with this, you may eat and eat and eat, and you are not even feeling satisfied.
That's dangerous.
So that is one of the mechanisms that, because when we talk about the whole concept of obesity, you realize that there are different factors that contribute to it, and there are genetic factors as well. Because all of us, sometimes you are eating food, you are really enjoying it, but you feel that there's no more space to take the food, so you stop, right? Because your incretins are working. Imagine if you didn't have that, like you will keep eating, like if you still have and you don't get that sensation. So basically that, and aside doing that, it also stimulates your pancreas to release some insulin, and insulin controls blood sugar. So it tells the pancreas that, okay, sugar has come in, let's go and pick it up into the tissues. But if this is impaired, that means that the person's blood sugar will stay up.
Okay, so is this drug very effective for weight loss, and is it safe for weight loss?
So it's a very effective drug for weight loss because, as we said, different factors. If you are not eating much, we all know that one of the major causes of putting on weight is your caloric intake, how much you are eating. So if there's a medication that is going to reduce your appetite, it's going to make you feel full, you don't really feel like eating, then eventually it's going to make you lose weight. And the fact of the matter is that yes, it is very effective. And as I said, there are actually different brands of it.
So again, on that same question, now for somebody who is now on this medication, it is one of the things that the medication does.
Yes.
But what about its effect on the person when on the other thing that it's supposed to really do, like take care of diabetic
insulin?
Okay.
Yeah.
So in medicine, we have to note that there are some medications that what you take them for may not be what they were originally intended to do. There are a lot of medications. Let me give maybe just one popular one is Viagra. That's it was not made for what it is currently used for. Actually, initially it was made for what we call pulmonary hypertension, for the heart, for some heart condition.
Okay.
It was for some heart condition. It was supposed to reduce certain pressures in the heart, but they realized that when it pulls out that blood, it takes it into the genitals, and that became a side effect of it. So that's what
side effect, dog. That's not, don't say side effect, dog. That's is part of the purpose.
Yes, so similar to that. Okay,
part of purpose.
So similar to that, if you when you read the literature, you realize that these medications were first marketed for type 2 diabetes.
Okay.
But if you look, a lot of people with diabetes also have weight problems, and there's evidence that if even someone has diabetes and they are able to lose some weight, even up to just 5% of their weight, it helps control the sugar. So it comes as an added benefit. But so now the medication is originally for diabetes.
Okay.
Now it's been shown that it helps with weight loss. So people have started using it for that. And even one of the brands, like the Wegovy that he mentioned, that one has actually been FDA approved in America for specifically for weight loss. So for people who don't even have diabetes, they can still take it. But as you said, people are abusing it. It's not someone like Lenny who would say, who would take it, because initially you mentioned her name.
That's what I'm coming to.
No, but what's her BMI?
No.
It's based on your BMI.
Let me stick on Lenny. She's you. Okay, I won't stick on you.
It's based on BMI. People are abusing it.
Yeah. So, Doc, I want to ask about the.
But also maybe Doc keeps saying BMI. Maybe you should teach us how to calculate our body mass.
Before that, Doc, what I don't want us to give a dosage on air, no. But what is abuse of this drug?
So abuse of the drug is that, as I said, it's medication for diabetes and for people who are overweight, okay,
and have a difficulty losing the weight with traditional methods.
Yes. So like we said during lifestyle medicine, you're supposed to do diet and exercise. So if you have somebody who is overweight, typically overweight is any body mass index above 25. But even it's not just that if you are above 25 you should take that. No, for something like the Wegovy, the recommended is above 27, but typically obesity is if BMI is above 30,
which you should explain to us afterwards.
Yes. So let's say I have a client, the person is obese. We've tried the weight loss methods, it's not working. And obesity puts you at risk of a lot of medical conditions. Then aside this weight loss, when I look at this person, probably the person even has diabetes or they are pre-diabetic, which means eventually if we don't manage properly, they can even develop diabetes in the future. Or they have heart problems, a whole lot of comorbidities. Then these are the people that you are going to give them medication to support them. You don't take
as an emergency.
Yeah, you don't take Ozempic or semaglutide just alone for weight loss. No, it should be in combination with the traditional weight loss methods.
Exercises, dieting.
Yes, dieting as well, reducing stress, because that is when you take the medication, and you start at a low dose and then you monitor the person, because as we say, everything comes with side effects. You can't just be so it's wrong that I know that people try to get it outside of the medical field or even illegally. We should also take note that there are fake ones in the market, and if you take this fake thing and you end up with you can end up with serious complications, because remember in the beginning I said that what the hormones do, those incretins do, they also stimulate the pancreas. If you are going to take fake medications or very high doses that nobody is monitoring you can end up with pancreatitis, like inflammation of the pancreas, and that can also be quite dangerous.
Doc, what is the link between using these medications and burning fat? Does it in any way burn, melt, or fat, or has nothing to do with
it? It doesn't melt. It doesn't melt fat. What it does is now.
So it has nothing to do with fat in any way. So when you have fat deposits,
you are no longer eating.
Okay.
So because you are no longer eating,
so indirectly
indirectly you are going to now burn what you've already what you've already conserved. So, and because it doesn't just burn the fat, and we have to take note, it doesn't work for everybody. It doesn't work for everybody, because if you look at how it acts, what it does is that it's making you reducing your appetite, and it's making you feel satisfied in a way. There are some people that their eating is not necessarily because they are hungry, or if some people's eating is emotional. It's more of emotional. So
food, stress eating.
So such people, it may not necessarily work for them. And also the evidence is that generally it just may not work for some people. That is how the world is. Something may be very good, or sometimes some people may try a certain GLP-1 receptor agonist. It doesn't work for them, but if they change, they can. Yeah.
Doc, you are going to talk about the BMI and how that's, because I know a lot of people are, for gym rats, they have used rat spa. For the first rats, it was very, very used, please. Gym rats would be always talking about BMI. We know body mass index. You've heard of it, but can you just break it down a bit for us with this conversation we are having?
So basically, your BMI is based on your height and your weight. So it's a calculation that we do. So it's a formula. Even if you take your phone. So it's basically your weight in kilograms divided by your height in meters squared. So if you have your weight and you have your height, you can always input it, and then you get the calculation for your BMI.
Is there a particular average BMI that is supposed to be for average people at a certain age or
age?
Yes. So normally, okay, even sometimes your ethnicity may be part, especially in the Asian countries where they are shorter. For them, their definition for obesity, the BMI is lower. But let me use in our settings. So in our settings, normal BMI is from 18.5 to 24.9. So that's the normal BMI. Anything above 25 and above, all the way to 29.9, the person is overweight. So normally from this overweight point, that's why people should start watching their weight, so that you don't tip and go above 30. Because above 30 is obesity.
All right. Yeah.
So one thing I want to know is, generally per statistics, are you guys noticing an increase of people running to this? Because you said earlier on that there are other traditional methods, your dieting, your exercise, but those involve processes. Somebody listening to this might say, let me just go get this. For example, right, people get surgeries to enhance their bodies onto each their own. You can either go to the gym or go to surgery. But with this, it's cheaper and it seems like it's easily accessible. So per the stats, are people running to these now? And is it becoming increasing? It's not necessarily
the
cheaper.
Medication,
yeah.
It's very expensive.
A month's dose will cost you about 7,500.
This Ozempic,
it's very expensive.
Wait, is it like a pill?
Can afford it.
It's an injection.
It's an injection.
Wow.
So Ozempic itself is an injection, but there's a brand of the semaglutide that is tablet.
And is that relatively the same price? Or
it's also still expensive.
$5,000.
It's,
I mean,
and
if
it's a weekly injection.
You go pay for gym. You go pay for gym for 4 years.
Yeah, that's what I said about BBL.
It's once a week.
Right?
It's a weekly injection.
If I inject this and it doesn't work there, then
But what do you want? What you want to lose?
No, I'm just saying. I don't mean like I'm just saying. Then either my body or the manufacturer will have to pay for it too. Hey.
But I mean, still though, are people running to these things? People can afford it. For now, we know the price.
People can afford it.
And people are saving up to get it. So it's not a consistent weight loss regime, right? So you save up, and then in August you're able to buy a month's dose, and then you knock out for the month, and you lose weight. And
so if you say they gain weight again,
September you know go for
no, that's crazy though.
You understand?
What?
That's it. Yeah.
And I'd just like to know, please, how many injections will you have to take? Is it just once? As we're saying?
No. So when it comes to weight loss, management should be individualized. You can't have a rule that fits for everybody. First of all, people are coming at different weights, and you have different targets for people. Like I said, some people need it because they have certain risk factors. Like as we said, it's a treatment for diabetes. So somebody can be taking it for their diabetes.
Yeah.
You know. So basically what you do is, as we said, it's a weekly injection. So based on all these parameters, and we'll look at the person's lab investigations, their cholesterol levels, their sugars and everything. So you start at a low dose, then you monitor the weight loss.
Wow.
So you monitor. As you are monitoring, depending on how the person's weight loss is going, you increase it gradually. There's a maximum dose that you can give, and we said that it may not work for some people. So if someone gets to the maximum dose and it's not working, you may have to
take something else.
Before we wrap up, our time is past 10 now, but before we wrap up,
and combine with diet and exercise.
Two questions. Where is this injection where is it given? Arm, leg, feet, where? And then secondly, do people use this in any way for weight gain?
No, you can't use it for weight gain. But basically,
or is there a conversation around such brands or drugs that rather should de-stimulate the way we said this one stimulates appetite, one that reverses it the other way around? But let's first off finish off with where the injection is given. It's very important.
So why?
Oh no!
This is
the local injection is Botos.
So
anywhere beyond that,
that one is you are giving it into the muscle. What you are talking about, the normal injection, but this one is what we call a subcutaneous one. So it's just let me say just under the skin into the subcutaneous tissue. So it comes with the needle. With a small needle. It's like a pen. You've seen how the EpiPens are. So it's something like that. And the vial is pre-filled with the dosage that you are supposed to give. So the person opens it, and typically along the side of your thigh, what we say the lateral thigh.
Not the gluteus maximus. Okay.
Oh no.
Okay. No. That's then explains it.
But you don't inject it the same place every time. It's just like how insulin. You have to change the site so that you don't irritate one particular area. Wow. But as we say, it's once a week. So
you trick yourself once a week with it. Yeah, because the reason I ask is because we learn from movies a lot, you know, and I can tell you that we see how some war soldiers just trick themselves and robots.
Even you can inject the abdomen too
as well.
Yes.
Yeah.
It's just like similar size but typically this one, since you are not injecting it so often on the thigh, it's
fine.
They should do one for muscles, man. Oh, that's steroids.
Yes.
Yeah.
But remember, they have side effects.
Yeah. Which we have to be very careful.
Yes.
Yeah. Okay. Once you were saying that if I'm going to inject, what am I losing my soul? Again, maybe can I say I feel big? Can I say I feel big? Do I have even a right to go like I want to?
Psychologically, you can say it, but
you can say you have body dysmorphia that people have. So that's why I was saying that at times some people don't even qualify for the medication, but they still want it because they feel that they are big, and that is why it's something that should be prescribed by medical professionals who have been trained, not just who have been trained on how to use it.
Wrap us up with the reversal of this. I asked that are there medications, under this conversation that rather de-stimulate That's
they stimulate your appetite.
Reversal. That doesn't want to make you want to eat. It makes you want to. Oh yeah, okay. Let me just
I think what he's trying to find out is
appetite
the effectiveness.
I know there are blood tonics and things people drink for. I'm just saying.
Is the effectiveness, right?
Yeah, you know how in this
or
case.
are there injections as well that can make you?
That will make you
eat.
You see, this one.
Dog, for people like me and him.
We. Under the same brands, under the same processes, under the same way it works. I was just asking a lighter question that same way does that I can just inject it on myself. That will not make me. If I inject, no, I eat potoyo wine.
Okay, I get what you're saying.
I was just asking on a lighter side.
Okay, so not in the way the Ozempic, yes, in that manner, but from what you are saying, aside the normal appetite stimulants that they sell. At times, those are for critically ill patients who are not able to eat. Sometimes there are some infusions that we give. Typically, some that may contain some vitamin B. Okay, and those infusions are just to help to boost, aside replacing the nutrients that they need, also to help with that. But we don't have, not that I know of, I haven't come across that yet.
Wow, Doc, thank you so much. This has been a very insightful conversation. I mean, it's it makes a lot of sense now, and why we see people, sometimes you just overly abusing this drug because they are so desperate to get a certain body shape and body size and all of that. And when they look at the journey of the gym, it's quite difficult, and the dieting with all the good food around, that this afternoon or this morning we'll be having some it's quite difficult running away from these temptations. But so people will then end up, so this must be prescribed, or is it an OTC?
No, it should be prescribed, even though like it's as we said, something like that Wegovy is approved for weight loss, but it should be prescribed because it's a medication that the person needs constant monitoring. So I can't
go over the counter and just ask for.
No, you don't go over. I know that people are doing it, but
of course it's wrong.
Yeah, but it's wrong. It should be prescribed because you need to monitor the person closely. Like I said, you can get certain complications and serious ones like pancreatitis.
Wow.